Our island continues the path to recovery following the damage caused by Typhoon Mawar, and one of many organizations on the island is American Medical Center. Dr. Erika Alford is one of their esteemed physicians. And Doctor, good morning. And as I understand it, there is one particular question that keeps bubbling up for people that has a very direct impact on Guam, and that's about insulin.
Good morning, Jason. The reason why I'm getting all those questions is because I'm an endocrinologist and diabetes is my specialty. And I've been getting lots and lots of messages from patients really, really worried about their refrigerated medications. And so I just wanted to allay a lot of these fears and hence giving you a call.
Okay, so what is the status right now if insulin has in fact, and it's supposed to be, has been refrigerated prior to the arrival of the storm?
So insulin that is unopened is supposed to be refrigerated.
Yeah.
However, to open insulin, it's supposed to be kept at room temperature. I don't think many people realize this. The difference is room temperature is supposed to be in an air-conditioned space because room temperature is under 30 degrees, and on Guam, it's a heck of a lot hotter than that. But most of us, myself included, at the office, we don't have GPA power. We're running generator right now, but even at the house, we don't have power. So I think a lot of my patients are in the same position and they're all worried about their insulin. So just so you know, once you open insulin, it should be thrown away after 28 days. Now that is unrefrigerated. Most people get their prescriptions 1 month at a time. And so by the time you need your next refill, it's time to throw it away anyway. So don't feel too bad about it. So 28 days without refrigeration, you're absolutely fine. That's the manufacturer recommendation. If it goes a little bit more than 28 days, the guess is you're probably still okay. Just keep an eye on your blood sugar. If it starts going up, let your healthcare provider know, and we can figure something out, get more from the pharmacy, work with the insurance company, and get you more insulin.
Understood. Okay, Doc, since I got you on the line, what about other types of medications or prescriptions that are in the sealed vials and everything like that? Will they be okay, for people that don't have power and water and lack of aircon, moisture, humidity, and that kind of thing?
So a lot of the newer diabetes medications also need refrigeration. So if you are taking Ozempic is stable at room temperature for up to 6 weeks. And so don't worry about it. If you have Ozempic, just finish your pen, you're good to go. Trulicity is a little harder. It's only shelf stable for 2 weeks without refrigeration. There are people who are getting power. So if you have friends or family with power, your extra 2 pens, send it over to someone with power because that's only good for 2 weeks. But Ozempic is good for 6 weeks. Okay. In terms of the other medications, every single medication is different. If you have access to the internet, and I assume you have access to the internet if you're watching this, go ahead and just Google your medication and refrigeration status because that usually pops right up. Then you'll know whether you need to discard it or not.
Gotcha.
Or you can
there you go. So doctor's orders, ladies and gentlemen, you may have to do she's got a little bit of homework for you today. So you may have to do some math, maybe check the expiration date or date when your prescription was actually administered or given to you and everything. Do the math, figure out, exactly what that date is. And if you, of course, like she said, if you have online access, just Google and you'll get the answers you seek.
Yep. And for insulin, at least, you can count 4 weeks after last Wednesday, and that's how long your insulin is good for. So don't worry about it. Keep using your insulin. Just keep it in the coolest place in the house, out of direct sunlight, in the shadiest spot you can find.
Okay.
And you should be good.
Yeah, a question for you now, Doc. What are the nature of the cases of the patients that you're seeing coming into the clinic? Now being day 6 of our recovery process.
So as an endocrinologist, I'm not seeing many because I'm usually seeing my chronic disease management patients. But my colleagues who are family practitioners and pediatricians, we actually opened up yesterday over the Memorial Day holiday. Normally we would be closed. We saw 60 walk-in patients and they were all typhoon-related injuries, lacerations, cuts, scrapes, I stepped on something, those kind of things. Now, if it's something that's small, usually we can handle it at the urgent care centers. So if the bleeding stops, when you put a towel over it and it stops sort of okay, go ahead and head to the urgent care centers instead of flooding the emergency room. But if it's a pretty bad one and you're like, this is not good, your best bet is to go to the emergency room. Now, even if you think it's okay and you go to the urgent care center and they look at you and they say, this is beyond our capabilities, trust them on it and head to the emergency room. Don't give them too hard of a time because they know what they're talking about. They know their capabilities and they know what they're not capable of.
There you go. Doctor's orders, ladies and gentlemen, once again. So Dr. Erika Alford at American Medical Center. And Doc, we really appreciate how you guys have been hustling, getting us back on the road to recovery.
Thank you. And one last thing I want to add. It's really, really hot out there, and we're doing a lot more manual work than I think most of us are used to. So please, please, please don't forget to drink water, drink lots and lots of water. As long as you're eating normally, you're probably fine with just water. And if you're drinking water that you're questioning if it's safe or not, don't forget to boil it for 3 minutes before drinking it. But don't drink it boiling.
Hydrate. That's a rule, the golden rule, as it were, of taking care of yourself, especially on an island as humid as Guam. So thank you once again, Doc.
You're welcome. Have a good day.
You too. We'll talk to you soon.